Sustainability Karma, a podcast series on sustainable development, sustainability, and ESG, or environmental, social, and governance, on AIR FM Rainbow Delhi 102.6.
Welcome to the section of Sustainability Karma. I'm your host Rajiv Tikku. Today we have a very special guest with us, Dr. Naresh Trehan. He does not need any introduction, but for some of our friends who may not know, he is the founder chairman of Medanta, the Medicity. He's also ranked globally one of the topmost cardiologists. Welcome, Dr. Trehan, to the section of Sustainability Karma.
Thank you.
Medanta has been more recently again ranked in the world's best hospitals by Newsweek. What is it that differentiates you from other private sector hospitals in the country?
Newsweek International, which does a survey of hospitals in 28 countries yearly, declares which is the best hospital. We have ranked as the best private hospitals in India for 6 years in a row, which is quite an achievement in a way. But it does not surprise us from that point of view because of the fact that we have always stuck to the core of patient care, not business. So everything that we have done, that is threefold. Three things that constitute the best services that you can offer. The one is the physical facility was designed in a way that maximum patient safety, lowest infection rate, and highest success rate of procedures. So it's a compliment in a way, it's an honor, and more importantly, it's a gratification to our people that they are doing a consistently good job over the years and serving the humanity to the best level at affordable cost.
The World Health Day theme this year is Healthy Beginnings, Hopeful Futures, focusing on ending preventable maternal and newborn deaths and also giving priority to women's health. So what are your thoughts on this?
It's after a long delay that the focus is inclusive now. So I think it has taken time for this to happen, but we are consistently trying to improve the level of care that is given from giving birth to a child to the oldest age so that they know that their security, health security, is at par with everybody. India has done a good job of actually promoting the safety of mother in the prenatal phase, during delivery, postnatal stage, and the health of the child.
More than 50% of deaths in India occur due to NCDs. And out of that, more than 50% are due to CVDs, cardiovascular diseases. So what would be your message for people?
So unfortunately, as is happening around the world, the non-communicable diseases, which include cardiovascular disease, diabetes, hypertension, and is on the rise. So much so, with our population, that even small numbers multiplied, small percentage becomes a large number. So it is true that this is a major concern to us, that NCDs, that we need to actually educate the public more than anything else. For NCDs, it's actually the public that actually makes it happen, not the doctors. We can only give advice, we can only monitor program.
What is your vision about India's healthcare sector going forward in the next decade or so?
So you see, one thing is that there is one common rule which has to be for everyone who is in the healthcare sector, is that every Indian citizen who's standing on the ground of India must get decent healthcare. It's a fundamental right. The challenges that you are talking about are the following. One is that if the incidence of NCDs, non-communicable disease, keep going up, it's going to be a big burden on our society. So we must actually provide the services to control it. And like I said, one of the efforts that the private sector can make is to do mass surveillance of our population, early warning systems, and providing some treatment for them if they are actually going towards a serious part of that disease. Secondly, with sanitation, clean drinking water and all that, reduce the disease burden from communicable diseases. So if we can work on both together, I'm sure that India can actually look forward to a much healthier population. The third thing that you can do is that collectively in the healthcare provider space to serve the public.
Thank you very much. It was wonderful talking to you and getting an overview as well as usable stuff for people.
It's all right, sir. Thank you.
Hope you like this program. This program is also live streamed on All India Radio. We look forward to your feedback on our WhatsApp number 9818120554. For participation in this program, write to us at sustainability.karma@gmail.com. Looking forward to meet you again at the same time next week with a new episode and a new guest. Till then, goodbye from all of us. Sustainability Karma, a podcast series on sustainable development, sustainability, and ESG.